참으로 반갑게 생각하고 있습니다. 晚上好，我是韩国웰牙科医院的林相哲院长。Hello everyone, it is nice to see you all again. I'm Sang-cheol Lim, private practitioner and periodontist from South Korea. I would like to welcome all Dentium users participating in this Dentium's live surgery show. Today, July 1st, 2022, our live surgery will be full arch implantation on severely resorbed narrow arch, narrow ridge with minimalism concept on lower jaw. Today, our operator is Dr. Chung also. I hope this surgery helps you in developing your treatment concepts and skills. Thank you. Well, let's take a look at today's case. Today's case, I already mentioned about full arch implantation on severely resorbed narrow ridge. As you can see, about the patient information, this patient, 62 years old female patient, her chip complaint was I lost a lot of teeth already, so I want to get the new one. Past dental history, he lost lots of teeth already after 2006, and also past medical history was large intestine cancer. Her general condition is very poor, so Dr. Chung determined the minimalism concept and minimized the implant fixture on lower jaw for the full arch rehabilitation. About the patient, the situation, we can see this panoramic view. As you can see, lower jaw, very poor periodontal and dental condition, as you can see. The only 45 premolar, 2 of premolars can be saved, and remnant of the teeth should be extracted. About the CT scan, number 47, narrow ridge, but acceptable, vertically and horizontally better condition than other ridge situation and ridge area. About the number 43, canine area, very narrow ridge, as you can see, and also these canine conditions were poor. 41, the same as before, and number 35, narrowed ridge, very narrow ridge. Number 37, knife edge style. So all of this condition is not acceptable regular diameter ordinarily. So we have to change treatment concept. So today, Dr. Chung show us about the minimalism concept for this sick patient. Intraoral scan, intraoral view looks like here. The lower anteriors may be a floating teeth, and the left side of the patient may be very resorbed and knife edge style. So right side also the similar, but the right side premolar area is better than any other ridge situation. So this number 44, 45, 2 of premolars can be saved and preserved. Is very lucky situation for the patient and the surgeon. So what about this lateral view? Fortunately, we can keep the vertical stop cause of saving the premolar, 2 premolars. So it is very lucky case for full mouth rehabilitation. As you know, full mouth rehabilitation case is very important to keep the vertical stop and vertical dimensions, right? So in this patient, fortunately, 2 or premolars, the working as a vertical stop and all the informations reserved these two premolars. So surgery plans is here. Extraction all the remnant of the teeth except number 44, 45, and implantation on number 35, 37, 41, 43, 47 area using bright tissue level implant. To frequently use this bright tissue level by Dr. Chung due to save the ridge and minimize the GBR procedure, bone grafting, especially elder person and compromised person situation is useful for this bright tissue level. Number 41, 35 areas will be the GBR procedure simultaneously implantation with bone grafting. At this time point, Dr. Chung is going to use collagen membrane 2, osteon xenograft, osteon 3 collagen. All of these products are brand new product from the Dentium company. So for getting better condition, better result, we can use this kind of brand new product properly. Just brief introduce about this osteon xeno, natural bovine bone grafting material with osteoconductivity, right? So we can expect osteoconductivity by using xenograft. The alloplastic material is just a filler, like a filler, working the filler, right? So, but however, this xenograft working more than alloplastic material. So we can expect better newborn formation using this kind of xenograft materials instead of alloplastic material. So collagen membrane 2 also brand new system. This collagen membrane getting better, faster wetting and easier manipulation, pin friendly. It means this membrane have a nature resilience, right? So it is difficult to tear. So we can use little bit the wider advantages using this collagen membrane 2 for GBR procedure. We can apply different types of GBR procedure. It depends on surgeon style. Here is a similar case. The GBR procedure on posterior area, all the remnant of the teeth the frustrated. So this remnant teeth should be extracted situation. So I already mentioned before, as I mentioned before, for this full mouth construction situation, we have to keep the vertical stop, vertical dimension, if we can, if possible. So unfortunately, this patient, we couldn't get the vertical dimension. So after implantation, when we have a prosthetic situation, prosthetic procedure, prosthetic stage, very difficult to get the proper vertical dimension. So we need more about this information and the intelligence of the patient and the architecture, and remove the extraction, the teeth, and remove the remnant of the bone, trimming and implantation, bone grafting, membrane application. All these procedures are normal GBR procedure, right? So the opposite side, the same as previous one, implantation and bone grafting and membrane application. This one is basic GBR procedure. Actually, this side performed by transmucosal GBR procedure, right? So this one is a panoramic view as a result of implantation. Provisional lustration here and final lustration here. Even though just the small bone volume, the patient get the full arch fixed prosthesis supported by implant fixtures. Very lucky for the patient actually. So this one is final prosthesis. And the similar case too, this one is vertical augmentation in lower anterior. As you can see, the collapse down lower anterior, the ridge area. So how can you overcome this kind of situation? So Dr. Chung tried by using guide surgery, digital guide surgery. So the implantation, the better and proper position, getting the higher insertion torque, we can connect with the healing abutment, the scan abutment, and applied with the bone graft material, and applied by membrane after this, and suture. These procedures called as transmucosal GBR. So the whole, the integrated, intermingled all the structures and new bone and bone graft materials and soft tissues structures, the healed one unit. So these procedures getting better and get a lot of advantages for the surgeon and patient. So nowadays prevailed this the transmucosal GBR procedures compared to the traditional style. And after the healing stage, a provisional lustration here, and final lustration. As you can see, lower anterior areas getting some of new bone formation, looks like here. So these situations getting better for long-term follow-up, long-term the stability, as you know. So, and the vertical augmentations was successful. Okay, this one is intraoral photos after final prosthesis, same case. Okay, so let's move to a surgery room. Dr. Chung is prepared for the patient and starting the surgery today. Okay, so today's surgery, Dr. Chung was planned freehand style, the implantation. Sometimes we can get the digital guide surgery in this case. It's sort of this multiple and complex case. But as you know, this kind of situation, sometimes, very frequently actually, freehand style surgeries are acceptable and adaptable. Now, Dr. Chung checking the proper point first, and then extract lower anterior, number 31 and 41. Actually, this teeth was floating, as I mentioned before, so it is a meaningless teeth for the final prosthesis, so extraction. He extract also the canine tooth attached with the number 42, the pani. And the simple extraction. And now move to number 45, the rootless remnant of this teeth. And all the teeth are removed from the patient mouth, and then he make incision using number 12 scalpel. The ordinary incision line, the crestal incision on lower jaw, the mid-crestal incision is the normal style. Upper jaw, as you know, the inclined to palatal, but lower jaw, mid-crestal. So he is using number 12 scalpel for clear cut incision here. After that, he is using the periodontal curette, double checking up the clear cutting. So clear cutting before flap reflection is very important procedure. So sometimes you can use just only scalpel, use sometimes explorer, like sometimes use this periodontal curette, and the many other equipment and instrument available for the clear cutting, the incision line. After that, the flap reflection here, using the pedestal elevator. And this procedure is a starting point for the further, the complex procedure. The lingual flap should be reflect for primary closure or some covering the defect area. If you can, the lingual flap reflect as much as you can, like as buccal flap. Okay, so here is the sounding, the remnant of the bone, very gently, and checking the bone shape, bone contour, and okay, so like a speckle of the bone is there. So this the part should be removed before the surgery or the after implantation, doesn't matter. Before suturing, you have to remove these bone spicules. Cause of these bone spicules is disadvantage to better soft tissue healing. Interrupt good the soft tissue healing. So you have to remove. The flap reflection, step by step. Very gentle and very slowly. All the granulation tissues and all the periosteum, the separate from the remnant of the bone, so we can see clearly the bone defect and bone morphology of the remnant of the bone. So the thinking about how can we deal with this area, how can we do the osteotomy, and which size of implant fixture is better. All the schemes all the schemes are available during this flap reflection and this sort of pre-surgery procedure. Actually, this round bar is very useful. This round bar actually from the sinus kit. This bar always make a lateral window when you have a lateral approach, sinus elevation. But sometimes, as you can see, removing the remnant of the bone spicules, and irregularity of extraction sockets. It's a very versatile instrument. For me, I loved using this black round bar. This round bar, the shape of this round bar, the spear type, it means higher contact surface to bone or some the other tissues. It means higher contact surface means efficient, better, more efficient when we use this kind of round black round bar. Okay, so after using the bone spic, after removing the bone spicule, a little bit more the flap detachment perfectly and soft tissues, removing the soft tissues and granulation tissues, including the granulation tissues, all the tissues removed from the bone surface. Okay, so yeah, we can see the big defect around this extraction socket of canine number 34. Number 43. Yes, Dr. Chung is thinking about the implantation and the implant fixture size and location, considering about all the three-dimensional position during this procedure. Okay, finally, he is starting to have initial drilling. Okay, he is taking a photo.
이렇게 밑을 잡아놓고 가이드를 할게요.
Yeah, he is position number 35 area here, using Lindemann drill, 7 millimeter, until 7 millimeter drill. Even though very thin narrow ridge, osteotomy is very important to get the proper positioning and the higher insertion torque when you have implant insertion. So if we can do the simultaneous approach and connect with the healing abutment after fixture insertion. However, unfortunately, lower insertion torque depend on bone types or the poor positioning or some other factors that contribute to getting the lower insertion torque. So we have to submerge implant fixture. For the convenience of patient and for the convenience of surgeon, we have to get the maximum insertion torque when you have osteotomy and implant insertion. So first, the drilling exercise is very important, undersized drilling and the lateral cutting or oblique ridge drilling. All the drilling procedures are very important. There should be exercise, dentiform or our patient mouse. And then, number 2, choose proper implant system. Maximize the insertion torque. We have to fully tapered implant system should be chosen, right? So I love to use Superline nowadays using this bright implant system from the Dentium. The almost 20 years actually long-term follow-up data support us for the better condition and the guaranteed long-term condition. Yeah, one good question from India. Thank you for India. The question is the prognosis of applying bright tissue level to the posterior okay? Yes, it is. Of course, okay. But depend on the diameter and length. The posterior ridge can be accepted with tissue level, right? So the regular diameter maybe 4.5, 4.0, better for posterior lower, and anterior maybe 3.5 is enough. A bright tissue level is stronger than the same diameter of bone level implant. Compared to each other, same diameter, tissue level and bone level, which one is stronger? Guess. Right. Yeah, tissue level is stronger. So even though the narrow ridge, we can choose smaller diameter. Even though on posterior area, we can this tissue level implant applied on these posterior areas. Okay. Thank you. Thank you again. Yeah. Some of moment, Dr. Chung already done two implant positioning. Number 40, maybe number 45 and number 47. Oh, the anterior side, number 43 area. Yeah. I guess number 43 and number 47 areas already done the positioning. Okay, so he is doing the bone grafting first and then implant insertion. This one is unique, Dr. Chang's style. His trademark. When he have socket implantation, immediate implantation, so bone graft first and then implantation. The many other surgeons are doing these socket immediate implantations, immediate socket, implant first and the bone graft later. However, Dr. Chung reverse type, the bone graft first and fixture later. And he is using now tissue level, the bright implant system. NTI 3.5 diameter, 9 millimeter. The platform is 3.8, bigger than the body. So this area, can you remember this the socket number 43 area, right? 43, yeah, done by a bright tissue level, 3.5, actually narrower diameter. But strong enough to endure this occlusal load, this area. Then after that, the moving to opposite side, number 35 and 37, 35 and 37, yeah. Already done on number 43 area, right? Okay, so we'll move to opposite side. Okay, so number 37 area, yeah, the same diameter, 3.5, and the length will be 7 millimeter. And number 35, the same size as the previous one. Okay, so he is doing the implantation. This tissue level, bright implant system, 3.5 diameter. 3.5 is the small diameter, so we can apply if this 3.5 of bone level implant, we can do this anterior region. However, as I mentioned before, the tissue level is stronger than the same diameter as of bone level implant fixture. So we can apply premolar area even though the molar area. Especially elder person or some compromised patient can be applied by this smaller diameter if we choose tissue level implant. The built-in type, the Dentium Bright implant, built-in type, screw abutment, built-in type, a unique style, external connection, so stable. The prosthesis over structures, very stable over structures can be achieved when you have this tissue level bright tissue level implant. After that, he is doing the anterior region. This area is maybe number 41. Number 41, 11 millimeter, a very narrow ridge. So he will choose narrower than the previous one, maybe 2.5, 3.0. Oh, 2.5, yeah, 2.5 diameter and 11 millimeter tissue level implant fixtures applied. Yeah. Very thin, narrow ridge, so we can see the crack, the bone crack of the labial side. Can you see the crack line during the implant insertion? So we have to do GBR procedure around this area. Okay, so removing the plastic cap. I have introduced about the bright tissue level implant, NTI. This tissue level, 20-degree external taper fit, built-in screw, abutment shape, very unique tissue level implant, right? Nowadays, the almost tissue level implant also have internal connection, right? A Straumann connection, 8-degree. But Dentium Bright implant fixtures, unique style, the external connection type. So this one is a stronger point, right? A unique and stronger point.
3주 위에 실밥 부르면서 밑에 임시차 다 끼고 그리고 4주 위에는 그 다음에 밑에 끼운 데 위에 번떠서 임시차 또 작업하고.
Yeah, he is talking to his staff in Korean. After 3 weeks later, he will have a temporization on lower, right? He talked about this temporization to his staff during the surgery in Korean. Maybe a foreign dentist couldn't understand what did he say. He told about this temporization very clearly. 3 weeks later, abutment with PMMA temporization. The patient can be received from the clinic. Okay, so yeah, this procedure, intramural penetration for better blood supply, the GBR site. There are many various factors contribute to successful GBR procedure, right? This blood supply is one of key factor of a successful GBR. So better blood supply Dr. Chung make a hole using high-speed bar, the decodification, the cortical perforation. So from the marrow space, blood comes out, this GBR appeared. So bone cells and there are many components promote new bone formation, bone grafting materials and GBR site here. Okay, he is applying the collagen membrane too. As I mentioned before, I introduced about this brand new collagen membrane. Compared to previous one, the version 1 collagen membrane is very reliable, and I can trust this collagen version 1. But this membrane so stiff, right? So some surgeons doesn't want this kind of stiff membrane. So version 2 is available for that kind of surgeon want to have the manageable and the flexible and resilient. Looks like this. So yeah. Now we can get wider choice, the barrier membrane. So if you want a stiff type, yeah, you can go straight to the version 1. But if you want the soft and the resilient style, you can turn to version 2, right? So each membranes they satisfy different styles of surgeon's procedure. The procedure of the surgeon style. So today, Dr. Chung is applied with the collagen membrane 2. Okay, so he is trying to transmucosal GBR. The transmucosal GBR looks like here, not submerged, not primary closure. The simultaneous implant fixation with the bone grafting procedure, and the connect with the healing abutment like here, and the membrane bone grafting also, and suture. The ordinary this transmucosal GBR frequently was done on extraction socket. However, Dr. Chung, not extraction socket site, frequently performed like this using the better regeneration products. Okay. The interrupted suture. For covering from number 43 area to number 37 areas, very long unit span that can be covered only for implant fixture, right? So, a very challengeable style. If you want to have like this simpler and predictable surgery, you have to get new weapon. It means new system like this bright tissue level, the stronger one, and also the bone graft materials, osteogeno, the better performance compared to alloplastic, and the collagen membrane too, a resilient style, and doesn't matter. Version 1 also working very well. I got a lot of experience about the collagen version 1, but this version 2 is brand new. So now I applying this the collagen membrane 2 on various situations when I have a GBR procedure. So I'm waiting for the result of this version 2 collagen membrane. In future, if I have a chance, I will talk to you about this version 2 collagen membranes, more precise and more predictable and experienced. Okay, so this one is a sandwich technique. Inside of this GBR site, done by xenograft, and outside osteon 3 collagen alloplastic materials. This sandwich technique, or someone called the layer technique, like this. First, this technique introduced and suggested by Dr. Daniel Buzer, named for control augmentation, a GBR procedure. But anyway, so okay, very nice. What is the advantages when we have this layer technique? Inside of xenograft, better performance for alloplastic material to make a newborn formation, right? And the outer surface, covered by osteon 3 collagen alloplastic materials, gave us the volume maintenance compared to autogenous xenograft. Alloplastic materials much better the volume maintenance performance, right? So we can get the dual function and dual mode when we have this sandwich technique for GBR procedure. And Dr. Chung is applying this area, xenograft and osteon 3 collagen also. Yeah. Another question from China, especially Beijing of China. What is the superiority of the osteon product in the case of immediate placement? Okay, so actually osteon 3 collagen or osteon 3 alloplastic materials working as a filler when you have an immediate socket. Immediate socket means extraction and implant placement and gap filling. All the procedures called as immediate placement, immediate socket, right? So the osteon 3 collagen is alloplastic materials. Osteon 3 particulated bone, osteon 3 collagen, collagenated bone, doesn't matter, just working as a filler. But the socket have a very high bone forming properties, right? Socket is higher bone forming properties, so the faster new bone formation between the gap, the socket and implant surface. If we apply this socket like as a xenograft, osteon geno, like as osteon geno, I guess higher performance than the just alloplastic material. Cause of this osteon geno have osteoconductivity. It means better the new bone formation, the activities, right? So gap filling is important procedure when you have an immediate socket. So just to put the particulated bone and coupled with osteon 3 collagen is also good, the procedure protocol. However, nowadays, xenograft or autogenous bone inside and then coupled by osteon 3 collagen, like a collagenated bone, also very nice, good choice for the socket, the management, right? So osteon have a superiority, the volume maintenance, right? Thank you very much. Beijing, China. Okay, so here is a suturing, very various technique, using very various technique, the horizontal matrix and vertical, the modified horizontal matrix suture, and the simple interrupted suture. The pin is not the suggestible. Why? As you can see, the lower anterior very thick cortical, so it is very hard to get the proper insertion of pin, right? So you can use pin, but the pin is not acceptable for this thick cortical area. So Dr. Chung having a suture. Okay, it was done. All of these areas done by Dr. Chung. Very nice, well done. For implant fixation with the GBR procedure and suture. Even though very narrow ridge, compromised situation, even though this very difficult situation, Dr. Chung done implant fixation using this tissue level bright implant system, and also the simultaneous GBR procedure, the transmucosal concept. Okay. Okay, the final nut was done. Okay, the well done of this area.
괜찮으세요? 마취 한 번만 할까? 다들 잘했어요.
Okay, so Dr. Chung is moving to another area, number 46. 46 should be extracted, and he is doing the implantation on number 47 area.
센 징지발 바이오 타입이라 이렇게 좀 잇몸이 톡 꺼지는 스타일이에요.
Yeah, thin gingival biotype. He mentioned, Dr. Chung mentioned about the gingival biotype. She got thin gingival biotype, so more cautious treatment is necessary, right? So thick is better. Thick is easier, thin is difficult, right? So extract and remove the granulation tissues. Okay. Yeah, so he got first number 47 positioning. He's planned the 9mm, 3.5 diameter tissue level implant. The platform is 30 3.8. 3.8 is almost same as 4.0 internal connection type, right? So 4.0 is a smaller, the ordinary smaller size for posterior covering, right? However, this NTI tissue level, even though 4.0 is enough to the covering this posterior teeth. So he chose 3.5, platform 3.8 tissue level right implant. Clapless drilling, 9 millimeter already done. So using the Lindemann. Okay, the final drill. 9 millimeter. Okay. He got 9 millimeter.
9mm를 쓰는데 350 쓸까 4009 쓸까 지금 생각 중이거든요. 아까 뼈는 다 됐는데 3509를 쓸까요?
Now he is considering about diameter of fixture size. So he's considering about number 47 area diameter 4.0 or 3.5. Finally, he got 3.5 diameter, 9 millimeter tissue level implant fixture. Full depth insertion 9 millimeter. Actually, he got undersized drilling for this 3.5 diameter implant fixture. So as you can see, very nice, well done implant fixation with a higher insertion torque. So it means connect with the healing abutment instead of cover screw. They are much better for the patient actually. Okay, in implant first on number 47 area. And this osteon xenograft applied the socket area. Yeah. So the bone grafting on distal root extraction socket, right? The medial root socket have impaction with the granulation tissues to skip the bone grafting.
거기에 가운데 뼈가 있어서 혹시 좀 그게 뭔가 하실 것 같아요.
He put the graft material on distal root socket area from the septum here and the distal root socket. So put the graft of xenograft on the distal socket, and medial socket have a big impaction with large granulation tissues. So just leave it, no bone graft on the medial root side, and the suture. Okay. A very simple application on lower posterior. So even though the freehand style implantation, very nice, well done paralleling situation, and the same level, very well done situation looks like here. So we can double check after surgery, took on the panoramic view, we can see more clear. And the PDRN injection. These PDRN substances make a faster healing of the tissues and bone grafting materials, right? So sometimes we can do this PDRN injection. Okay, Dr. Chung finished all the great surgeries, lower mandibular, almost full mouth reconstruction. Okay, thank you for watching. And I will be back in 10 minutes. And after that, the Q&A session we can see panoramic view after post-op. Thank you. Welcome back, Dentium users. As you can see, today's live surgery is very successful. So Dr. Chung, 1, 2, 3, 4, 5 implant fixtures installed on lower jaw of the compromised patient. So even though this narrow, the uncomfortable ridge shape and situation, 5 implant, bright tissue level implant can support all the arch, looks like here. So 9 millimeter, 11 millimeter, 111 millimeter, and 7 millimeter tissue level implant was done with the higher insertion torque, connect with the healing cap. So even though the freehand case looks like the digital guided surgery. So I deeply appreciate Dr. Chung once again. Okay, so let's take the Q&A session. Let's take a Q&A from overseas doctors. First one, what are the precautions when using tissue level at the anterior? Tissue level is very good and useful and versatile implant fixture system, right? We have a wide consensus about this tissue level implant. However, in aesthetic zone, we have to consider about the depth of implant fixture. So this tissue level is very delicate to make a upper superstructure. So even lower anterior doesn't matter. Actually, the compromise, even though a little bit poor aesthetic situation and poor aesthetic outcome, however, upper anterior is very severe situation when you have unaesthetic outcome in case of a tissue level implant. So we have to consider the depth of implant fixture is very important factor to make a good aesthetic outcome. So little bit deep insertion is a necessary part and suggestion for you. Okay, thank you for Guangzhou from China. This good question from Guangzhou Yixiang from China. And number 2 question, I would like to know at the position number 47 that he used tissue level bright implant, 3.5 diameter, 9 millimeter length. It is enough to observe the force of occlusion teeth. Yeah, very good question also. I mentioned before, as I mentioned before, this tissue level implant is stronger than the same size of bone level implant. It means 3.5 fixture, tissue level fixture have a 3.8 platform area. 3.8, the very similar 4.0 internal connection bone level implant. Compare each other. 4.0 is not enough for the occlusal force, the posterior, lower or upper. Lower posterior, even though the 4.5 and 5.0 is regular size, right? 4.0 internal connection is very risky. Sometimes at the fixture, the tearing or some the superstructures, fractures can be happen, even though the malposition like this one. However, this tissue level, like especially bright implant, bright tissue level, it means bright tissue level have an external connection, right? So external connection 4.0 is stronger, much better than the internal connection of bone level 4.0, right? The same, almost similar, same diameter, top portion, the platform area. This one is internal connection from the bone level is a little bit risky and weaker. The support the occlusal force on the posterior area. However, this 3.8 platform, body 3.5, in external connection tissue level can be endurable, right? Even though handicapped patient, elder patient, or like this compromised patient, can be acceptable like this picture with minimalism concept. So Dr. Chung suggests us a minimalism concept for elder patient using this bright tissue level external connection type picture system. So we can try. And actually so far so good. Long-term follow-up data, we got more than 2 years using this the small diameter tissue level implant picture from bright system. We got more than 2 years, around 2 years. So far so good. We need more the follow-up data. However, I trust this tissue level implant even though the lower or upper, the posterior area, right? Oh, this question from Thailand. Thank you again, Thailand doctors. Okay, actually, 증탄 the 시즌 the baden, one baden, Beijing 시즌 one 치den, right? So thank you for watching to our live surgery show. Next live surgery will be held July 15th. So please keep checking the date and see you again. 부젠 부산. 谢谢大家。